So we are going to be taking a tumor off of the back leg of this little girl, and then we will be cleaning her teeth while she's asleep. Her teeth aren't too bad, don't see a lot of fractures or anything like that. However, anytime the patients are asleep, excellent time to do a dental cleaning, get that calculus off of there, and their overall health will be better once we get the bacteria, tartar, gross out of the mouth. Go ahead and shave and get prepped for the procedure. This bag is filling up too. We're sure she's in? Tube's in? Let's double check, just to be sure. Pull tongue open. See?
Yeah, it looks like it's fine.
Okay.
Yeah, it's between the folds. Big space in there. Oh, she just opened her eyes.
Oh, well, that's helpful.
She's okay. Might not be able to move too.
I'm not getting any ice in the back. Ooh, you have a dreadful breath. Being a little stubborn, princess. So we ended up changing the endotracheal tube that we were using on our patient. Went to a larger size, so she's moving a little bit more of the gas anesthetic, staying asleep a little bit better. So just modified our anesthetic protocol just a little bit, and everything's going better now. We're going to finish prepping for the surgical procedure. All right, so we're going to be removing this mask. Get some towels on our patient. And we do have the fun of another veterinary student with us.
10 or 15, Doc?
Let's do a 15. Got a little skin tag right there too. All right, so we want to get good margins on both sides, and we know about how deep we're going. So I want to cut in an ellipse so that it's easier to bring the tissues together. So I usually press, giving a little bit of tension to the skin, and then press down on the blade. And this is where the amount of tension varies based on kind of skin and texture. It's always a little bit different per patient. Sometimes if they're a little bit older, skin might be a little thicker. We might need to have you come around to give her a couple breaths. She's puffing a bit. I tend to not do a lot of just hack, 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 because you cut the vessels and then boom, you got bleeding everywhere. So I try to loosen a little bit with the instruments. Copper to forkant.
Exhausting bag, patient's on 4%.
Heard. Hang on, pumpkin. All right, can you infuse this with the lidocaine, which is over there, please? Lifting up. Kind of see how deep we go, and we could feel how deep we were. This one was luckily more intradermal when we were feeling it. So with the scissors, the nice thing is you don't always have to cut. You can kind of go against it with the opening.
Okay.
And if it is, exactly. And depending on what it is, if it's just that light fascia, it just opens right through it. We have our jar. All right, let's have some 3-aught, Kent. And the sub-Q will be a continuous layer. You want to do it?
Formalins open.
Coming. And then with the formalin, try not to splash. Go down gently and release. Otherwise your techs are like, what are you doing? So I would do, we're just going to do a subcutaneous layer, a couple bites to help bring everything together. And then the skin we're going to do external, simple interrupted. Because this little one will come back for suture removal. And just do 4.
Patient's not breathing independently. They're pretty shallow, but she is breathing independently.
Okay, we'll go back to 3%.
Exhausting bag, we're on 3%.
Okay, so these don't have to be quite as close together for what we're doing. See how it's coming together? Okay. Okay. Good. Cinch that baby down. There we go. All right, let's do this last one and make a knot. So let it just come together. That one's nice and easy. The second one, nice and easy, just on top. Stop. And your third one is the one you tighten down. Oh, it's good right there. Perfect. And then your third one, tighten. Then your fourth one, tighten. And that keeps them from getting too tight all the way down. Makes it much easier to find when you go to use your suture scissors. And if it lays funny, throw one more and it'll lay better across the top. So do one more. Just make sure you need to leave enough for them to grab. Yeah, good catch. Couple more. Couple more. Almost there. Alright, let me see if I can bury this last pooch. So you kind of run it under the skin, and then do a cruciate and tuck it in there. So if you run it kind of along the sub-Q like that, you force everything down. So it folded everything in on itself.
Very nice.
And then you've got little bits that you think are poking out. You just take the little hemostats. You can kind of tuck them in and flip it. All good. Looks great. We're all good, Kent. No glue. Make sure nobody's little edges are caught on anybody. Good job. Great. All right, we'll set all this up here. Hey, Nicole. Or Kayla. We're gonna transfer out for her dental. Oops, we're caught. Kayla, you ready for us to move? Yes. All right, so turn off our oxygen and get our temperature, 99.3. Make sure nothing drops. Everything else is unhooked. And then we need to make sure oxygen's off and turn off our surgical lights. You want her lateral? How you want her?
I want her sternal, please.
Okay, there's cords by my feet.
Perfect.
All right, she was doing a little huffy puff, so. Where's that brown towel? Let's give her some armrests.
We need something better for the net. Better towel, please. Big towel. Thank you. One more.
And I need a bumper. Thank you.
So we think we're on the left side of the dog, so this is the dog who's left.
Finished cleaning teeth and double checked our mass removal site and everything looks really good. Got that cleaned up. Sometimes there's just a little bit of oozing around the incision, and so now our patient Annie is going to be waking up from anesthesia. It's always a great time to trim nails when they're sleeping because no ticklish toes. So that is all for today's video. You guys are off for the afternoon, and as usual, we will check in with Annie as she is waking up. Don't forget to like and subscribe. We'll see you soon. Thank you. We all smell like peanut butter. Well, she's awake. She's singing to us. We're gonna get ready to send her home. Have a great weekend.